Pleased to welcome Maria Taffe from McNally's Chemist in Newry, back with us for another week of advice, pointing our needs in the right direction. The needs this week is the needs of mouth and teeth and oral hygiene and all of that.
Yes, Rowan, I thought we could continue with our theme. We had talked about eating. We
Eating.
talked about nutrition.
Yeah.
We talked about obesity. We've talked about eating disorders. So we could
The
talk
crunchers.
about, yes.
And we go for the teeth. Right. From you, do people come into the chemist with teeth problems? Surely they go straight to the dentist.
Well, it would be more oral problems. It may not necessarily be a tooth problem. Unless it's an emergency situation at 9 o'clock at night and somebody has quite a bad toothache.
Yeah.
Which happens on a regular basis.
Really?
It seems to be in the evening time, when the dentist is closed, that toothache seems to strike.
But I mean, why do people get toothache?
Well, it's all down to, usually it would be a cavity or something that has reached even the nerve of the tooth that has caused
carelessness
pain.
and not getting repairs done.
That sometimes
not looking
can be,
after in the first place. That
yes,
kind of thing.
There's multiple reasons that could be causing a toothache. But to start off, your mouth and your teeth are extremely important, and that is why we do have a wide base of knowledge regarding your mouth and your teeth. Obviously, they're the first part of your digestive system. So that is processing your food to keep us alive. And your teeth have so many functions, and there's a good few different types of teeth. So you're crunching and crushing and tearing food, all helping in the process before they reach your stomach. So you're getting your food prepared for reaching your stomach.
You have incisors, you have molars, and you have these things here, like the fangs. What are they?
Your premolars, your pre-incisors, and your... What's the name of them?
I can't remember. And I should know the name of them. They're the two pointy ones that stick down like Dracula's teeth, and that would be it. But I mean, these weren't given to us by evolution for eating lettuce. Mm-hmm. They were given to us to tear meat apart.
Yeah. Well, the other second reason why your teeth are so important, in today's society, we place a lot of aesthetic value on having nice white pearly teeth that are clean and fresh. And yeah. So our teeth are so important for both reasons. And keeping your teeth clean is obviously a very important process. You lose your milk teeth or your baby teeth by the age of approximately 6, and once you get your adult teeth, you're only getting one natural set, and therefore it is extremely important to keep them clean and healthy.
Yeah, the cleaning of teeth, you can. I thought you just cleaned it for all your work, clean, and then I realized I was doing it with such enthusiasm that I was peeling the gum back.
Oh, jeepers.
Imagine doing that.
Yes.
That you were doing it with such gusto.
I think I actually may have that issue myself.
That can happen.
There are a couple of important things to remember when you're cleaning. The first thing is brushing your teeth twice a day. So the most important time is before you go to bed at night. You don't want bacteria and food or whatever else sitting on your teeth for that prolonged period of time. So before you go to bed at night is the most important time. And then one other time during the day. So most people will go morning and night, and that's perfectly fine. Brushing for 2 to 3 minutes at a time. 2 to 3 minutes is the recommended period of time that will allow you to adequately clean all surfaces of your teeth. And flossing is highly recommended.
You need to be a sort of a most dexterous person. You need to be an acrobat with your fingers to be able to floss right. And, it's a very difficult thing to do.
Yes, the purpose of flossing is to remove the plaque or any food debris from between your teeth, and it's estimated that up to 40% more debris is removed by flossing with your toothbrush than toothbrushing alone. So 40% more plaque or debris is removed by flossing with brushing instead of just brushing alone.
So brushing, absolutely.
So flossing, it's not just a simple up and down movement. The floss should be manipulated to actually try and remove plaque from all areas in between.
So if you can get in and you're flossing this way and it's into the back you're getting,
yeah, you should manipulate the floss in any way that you can. You'll find that it does remove the debris from between the teeth. It also helps prevent gum disease. It also helps with bad breath. Because we'll talk about bad breath in a moment, but it can be the debris that's caught in your mouth that will cause that.
There's an absolutely awful ad. It revolts me when I see it. Maybe it shouldn't. Maybe it's a very good ad on television. It shows blood coming out of a person's eye, a woman's eye, and it says, you wouldn't ignore blood if it were coming from any other part of your body. You do if you're brushing your teeth and they spit into the sink and there's blood in it.
Is that awareness of gum disease, I'm presuming?
Yeah, absolutely, yeah.
So if you are brushing properly, Rowan, brush twice a day, 2 to 3 minutes, and floss. It's actually quite important what toothpaste you use also.
Really?
Yes. One containing fluoride is the most recommended form of toothpaste. Fluoride actually helps strengthen the enamel on your teeth. And enamel is actually the strongest substance we have in our body, but it strengthens it further. So you're looking for toothpaste with approximately 1,000 parts per million fluoride or more to ensure that your enamel is strengthened.
1,000 per million. That's interesting.
1,000 parts per million.
That's amazing.
And there is fluoride in our water supply. I'm sure you're aware. But it's very few regions within the UK that actually have adequate fluoride levels. So that's why we supplement with toothpaste.
Now, in the toothpaste, the use of toothpaste, I'm sure I'm right. There's the head of my toothbrush. Down it and back, and then nice load of it and put it. Is that the way I do it?
Well, it's usually a pea-sized amount that is recommended.
A pea-sized amount? A tiny bit?
Yeah, just a small amount should do the job.
There you are.
Yeah. Most manufacturers of toothpaste recommend the amount that you should use at a time. A controversial area, actually, Rowan, is mouthwash.
Listerine and the like.
Some dentists recommend mouthwash, other dentists don't. In the case of a person who's not suffering from any other dental issues, a dentist may not actually recommend mouthwash. It's thought that the benefit from brushing your teeth and then using a mouthwash straight away washes the toothpaste away, and it's maybe not a good thing. If you are planning on using mouthwash, it's recommended that you wait at least 30 minutes after you brush your teeth.
My goodness, that's new information for me anyway.
Or use it at a different time of the day. If you have mouthwash with you, say, during the day at your work and you like to wash your mouth out, that would be perfectly fine. However, if somebody is suffering from an issue such as gum disease, there are antiseptic mouthwashes available. So chlorhexidine mouthwash is found in Corsetol. That is available and is recommended for those types of people.
Now, if we let it slip and it goes wrong, and we get a toothache, and we ring you or come into you at 9 o'clock at night.
Well, hopefully your dentist would detect any issues that you may be having, hopefully before an actual issue would occur. Dental checkups are recommended anywhere from between 3 months to 2 years. So a person, say maybe a smoker, who has a higher rate of build-up of plaque or staining, they may need to get their teeth checked more regularly and cleaned more regularly by a dentist. So they may wish to see their dentist every 3 months. And if there is an issue there, the dentist with cleaning, the dentist hopefully would be able to point that out. There's also oral hygienists at the moment, you would hear.
Yeah, you can book one of those through your dentist.
Yes, they would be able to advise you on your cleaning process to ensure that you are reaching all areas of your mouth. For a normal person, my dentist recommends a checkup for myself between 6 months and a year. So as long as you're getting those regular checkups, you should be able to detect the problem before it actually occurs.
But if there is the onset of unexpected toothache,
yes, that does happen.
Or is there something you can give that will deal with it?
All we would be given really would be something to ease the pain. It would be a dentist dealing with a true toothache.
But is it possible to ease the pain?
It is possible to ease the pain.
So painkiller works
we
in
have
your mouth.
over-the-counter painkillers, you know,
Yeah.
paracetamol, which
yeah.
is usually first-line treatment for
Yeah.
most pain ailments. You also have ibuprofen, which would take down any
Yes.
associated swelling. There are also newer agents on the market which can be applied directly onto the area. I'm sure you've heard the old wives' tale of clove oil.
Oh, I have, of course, of course.
A lot of people do say that it works if they ever have a problem.
Yep, absolutely. But the the basic truth is you really need to take it seriously, because we ignore it at times. Personally, I find that I need my teeth clean, or else I feel dirty all over.
Well, it seems, Rowan, that sugar is the enemy.
Wow.
Sugary foods and acidy foods. Once a sugary food sits on the tooth surface, the bacteria then feeds off it almost.
Yeah.
And produces acidic substances, and it's these substances that actually break down the surface of the tooth, break down, cause cavities, cause the toothache, and that is what damages your tooth surface. Also, smoking is recognised as reducing the blood flow to your gums. So once this blood flow is reduced, it gives more of a chance for gum disease, a higher chance for tooth loss even. So I'm sure we've actually touched on gum disease just a moment ago.
Yes, indeed.
Yeah,
indeed.
yeah.
But the gum disease is there, and that can sometimes lead to halitosis, the bad breath thing.
Yes,
but that can also come from further down in the stomach.
Yes, bad breath. There's a number of causes. The most regular cause of halitosis is poor oral hygiene. Now, that's not always the cause, but in most cases it is. So you have the sulfur gases that cause the bad breath.
Oh, God.
It can sometimes be some of the foods you eat. It can be smoking, obviously, that as well can cause bad breath.
You can see me grimacing when you mention smoking. I detest it. It doesn't make any sense to me at all, I tell you.
I know.
So the bad breath, then, if it's in the stomach, it's a more difficult thing to deal with.
Well, as I said, in most cases it is poor oral hygiene,
scrub
and we
your
would
teeth.
recommend treating the oral hygiene dysfunctions first. There are other, as you said, coming from your stomach, that is possible. There are sometimes, whenever there's a coat of debris over the tonsils, like tonsillar stones, that can cause a very bad smell of the breath. There are probably certain medications that people feel make their breath smell bad. A person with diabetes, actually a bad smelling breath, or a breath that smells very, very sweet, almost like pear drops, can be a warning sign that a person's blood sugars are completely off the chart, and that it's the start of an emergency situation. So that's another reason to watch out for bad breath. But as I said, it's usually oral hygiene, so you'd start with making sure the teeth brushing process is correct.
Yes.
They're using their floss. Mouthwash, sugar-free chewing gum actually can improve bad breath. And then the sulfur gas, as I said, so there are certain mouthwashes specifically produced to reduce the number of sulfur gases. There's a new mouthwash on the market, CB12. Well, I suppose it's not too new. It's been out maybe a year or more.
Oh, yeah.
Now, I'm sure you've seen TV adverts for it. It has a combination of products, including the antiseptic chlorhexidine, and I think it's zinc they also use to neutralise sulfur gases.
My goodness. It's complicated, but I mean, it can be simply dealt with. And
Yes,
it's proper
simply dealt
oral
with.
hygiene.
Yes.
That's the mouth oral hygiene dealt with. What's been keeping you busy in the practice this week?
This week, I think the change in temperature has surprised a lot of people. So we're actually starting to see the start of sore throats. Hopefully not coming into cold flu season already, but definitely the change in temperature has surprised a lot of people. So we are seeing some minor cold type symptoms.
Yeah, you're busy down there.
Oh yes.
Kept going.
Busy as usual.
Yeah. How is the robotic service working?
Oh, it is excellent. Yeah, the robot is its usual self-predictable. That's a good thing. And our kiosk as well.
It's all good.
Yes, it's been used.
People are using the kiosk. They
Oh
like it,
yes, lots of people love the kiosk.
Absolutely.
Yeah.
Well, look, Maria, thank you for coming in, and
No
we wish
problem.
you continued success in being of service to the people of Newry.
Thank you, Roland.
Well done. Take care.